I have a project for my anatomy and physiology, biology 165 class. It is to talk about and inform on diseases that affect the body that specifically target the bones or the muscular skeletal system or the nervous system in our bodies. Um, I chose to do Parkinson's disease. It affects a lot of your body's daily activities. Um, Typically, you're over the age of 60, but you can also be diagnosed around your age of 50. It's more common in men than women. And this disease affects a lot of your movement, your body movement, such as walking, such as your speech, such as brushing your teeth, brushing your hair, putting on your clothes, sitting up, just a daily task of sitting still in a chair, such as I move my hand, I tell it to move. It's very difficult for somebody who is progressing in Parkinson's disease. Typically, there is no actual diagnosis for Parkinson's disease. They have four main characteristics or four main symptoms. You have to have at least two. They do a medical history of you plus your family, but only 10 to 15% of people with Parkinson's disease get it genetically. The other 85 to 90% is just something that spontaneously happens. 10 signs you should consider to go tell your family doctor, hey, I have these symptoms. It's not to worry, but you should seek more information from your primary care doctor. Tremors, which is shaking, small handwriting, the loss of smell, you have trouble sleeping, trouble moving or walking, constipation, a soft or low voice, a masked face, dizziness or fainting, and stooping or hunched over a lot. Those are 10 signs to inform your doctor that you have these signs. After you go to your primary doctor, you will be referred to a neurologist. They will do tests on your brain and to test how your brain reacts and tells different parts of your body how to move and do different things and how quick of a response your body lets your body know to make that movement, or if you get like stuck in a certain position and it's hard to turn or hard to take that first step. Other other side effects, I guess I could say, from that is drooling. You have trouble swallowing. You can't swallow as easy. These are just different different aspects, different signs. A lot of the time, Parkinson's will start on one side of your body, the left or the right side. You can have therapy. You can go to an occupational therapist. You can go to a physical therapist. Consult your doctor with the next steps that you need to take as your disease progresses. Talk to a medical social worker. I've seen it and I've seen it progress and I've seen what it does. Sometimes the person is just frustrated because they have trouble talking. They can't say what they want to say, and a lot of people are independent and don't necessarily want the help or want to ask for help, and they see that their disease is progressing and getting worse, and it's frustrating to them, and it's different. So it's different. It's the change. It's something that's not necessarily easy to cope with, being either the family member, being the person, being the caretaker, or just seeing somebody with the Parkinson's disease. Um, just it's a disease that affects not just the one side of your body that's affected, but it'll eventually affect both sides. And whichever side it originates on is the side that will have more difficulty than the second side of your body that eventually it'll take over. The statistics, about 1 million Americans live with Parkinson's disease. It's more than the combined diagnosis of multiple sclerosis, of muscular dystrophy, and the Lou Gehrig's disease. So those three diseases, takes those three different diseases of all those people, and that's how many people in America are diagnosed with Parkinson's disease. More than 10 million people worldwide are living with Parkinson's disease. Estimated 4% of people living with the Parkinson's disease are diagnosed before the age of 50. And then men are 1.5 more likely to have Parkinson's disease than women. Income for people living with Parkinson's disease over the whole year, dealing with healthcare, dealing with medicines, dealing with medical doctors, with results, with tests, with someone coming into your home to help you, or having to live at a facility and getting daily care. All of that costs money, and it's an average of $25 billion a year. Medications alone are around $2,500 for Parkinson's disease. They have different medications that'll help your symptoms. They have therapy and different things to help change the symptoms, but eventually it will progress. And also they do have a surgery that can help some of the symptoms, but it's a progressive disease. There's no cure for Parkinson's, so it's something that you have to deal with, and eventually it'll succumb and take over. It affects your non-motor skills, sleep disorders, hallucinations, weight loss, weight gain, impulsive control disorder, and cognitive changes or mood swings are some of the non-motor symptoms. There also are mixed symptoms and non-motor symptoms, which is like the soft or low voice and the trouble swallowing, trouble talking, and the drooling, which is due to not being able to swallow as often. This disease, I've seen it a few times, and it's something, something some people have to deal with, and it's kind of hard. But, you deal with things the best that you can. And that's just some of the information and statistics and some of the effects that Parkinson's has on your body. And if you have any further questions, I Googled Parkinson's Foundation. Or I just put in, I think I actually Googled degenerative nerve disorders and Parkinson's, and a couple other ones came off of, which led me to the Parkinson's Foundation, which they have a lot of good information out there. So that was just some information on it. Thank you.